Heather Garcia holds her 3-month-old baby Jonah a little closer today after a rare diagnosis had Jonah in emergency surgery at just 7 days old. Jonah was born with malrotation with volvulus, malrotation affecting intestinal positioning, and volvulus twisting the bowel and killing it as a result.
To the best of our knowledge, there's absolutely nothing that a mother can do to prevent malrotation. During very, very early development, the intestines actually develop outside the abdomen. They start out as just a little string that then sort of grows into a loop and becomes more and more complex. And then it sort of twists and settles into its normal location. But very early on in the first trimester of pregnancy, if that process doesn't happen just perfectly, that's when you get the abnormalities.
The Garcias say the Providence St. Jude Medical Center in Fullerton owes them an explanation after misdiagnosing their son, even though their prenatal physician suspected a bowel blockage on an earlier routine ultrasound. Heather was sent for additional imaging, but no malrotation was seen, and the lack of follow-up is where Jonah's parents say their physicians were negligent.
But I remember waking up from the little brief naps that I would take in between feeding Jonah, and he had vomit all over his blanket, and it was a neon bright yellow, and I have never seen that before either. So, right away we brought this over to the nurse. We even showed her the actual blanket.
After 2 nights at the St. Jude Neonatal Intensive Care Unit, Jonah was transferred to Children's Hospital of Orange County, where he was almost immediately diagnosed with volvulus. Pediatric surgeon David Gibbs saying that every second counted.
You can lose the majority of your intestines in 8 hours. And in some cases, that's incompatible with life. And another tragedy happens when the intestines are lost, but then the baby survives for a period of time before ultimately succumbing.
Although baby Jonah's surgery was successful, his month-long recovery in the hospital was trying and difficult to witness for his parents. Jonah may not remember his valiant stay hooked up to wires and feeding tubes, but those images are imprinted on Jonah's father, Ezekiel, who feels let down by who he trusted the most.
So I took the doctor's word for it all the way until we came home, and he was still spitting up, and I was like, there's no way this could be normal. So at that point, it's when I figured, okay, something's definitely going on.
Like the Garcias, Megan Glover found herself lost after her newborn son Camden was diagnosed with volvulus 6 years ago. She founded the Intestinal Malrotation Foundation with a mission of educating the world about this rare disease.
When a parent or a mother or a caregiver comes in frantic saying, my child is sick, they need to be heard. They need to be heard. And these providers need to understand the hallmark symptoms because they're very telling, to at least look for this condition because it is so life-threatening. And you're absolutely right. With appropriate education, leaving the hospital, if parents are armed with that, they're able to advocate for themselves and their children if they see some of these symptoms arise.
In Anaheim for OC News, I'm Chris Adler.